Hi, this is Amy Hagel, SHINE Liaison at Senior Connection Center. Today, we have one of our fantastic SHINE volunteers, Jim, from Highland County. We know that Medicare is complicated, so we have created this weekly video series that can answer some of the questions that you might be having. Today's topic, we're going to be covering some of the questions that we have received from some of our clients' representatives. Because we do talk to Medicare beneficiaries, but there are times that we need to talk to their family members. So one of the first questions that I'm going to be asking to you, Jim, that we get all the time, how can they assist their loved ones in making good healthcare choices?
Well, the steps that you need to take depend on the situation that your loved one is in. If they are fully capable of independent living and they primarily just need information about Medicare and related insurance and help in choosing a cost-effective plan for them, or help seeing if they may be eligible for assistance with drug costs or with premiums, all they need to do is talk with a SHINE counselor. We can certainly help them with these things. If, on the other hand, they are struggling to continue to live independently and they need services in their home, or if they now are in a long-term care facility or soon will be going to a long-term care facility, in addition to talking to SHINE, they should probably speak with someone with the Elder Helpline. You can reach the Elder Helpline by calling the same number that you would call for SHINE, which is 1-800-96-ELDER, E-L-D-E-R, or 1-800-963-5337. And if you call that number, you have options. And instead of picking the option for the SHINE counselor in that case, you would pick an option for an Elder Helpline specialist and leave a message, and someone would call you back and help you with your questions.
That's excellent that there's so many tools for people to get some answers. So another question that we have received that some people that they want to know, does Medicare covers the custodial part of long-term care?
Medicare will cover a stay in a skilled rehab facility for up to 100 days after you've been an inpatient in the hospital for 3 days or more. And if you need to go into a facility for physical therapy or other skilled services while you're recovering, Medicare will cover that. But if you reach the point where what your needs are strictly custodial, or when your 100 days are up, Medicare will no longer cover this. Now, you may be eligible for Medicaid to help with these expenses or some other form of assistance. And so at that point, you would probably want to call the Elder Helpline and get the ball rolling there. But Medicare will not cover after 100 days or when it's strictly custodial.
Okay. Another question that we get quite often is how does Medicare works for people that are receiving Social Security disability?
When you're receiving a Social Security disability benefit, you become eligible for Medicare on the first day of the 25th month of your disability. Prior to that point, you may very well be receiving some form of Medicaid, either full Medicaid or medically needy share of cost. Now, once your Medicare becomes effective, before it's effective, Medicaid will be primary. But once your Medicare becomes effective, then any expenses are covered first by Medicare, and only what is not covered by Medicare goes to Medicaid. Once someone is eligible for Medicare, Medicaid no longer covers drug expense. Sometimes people will ask if they can decline Medicare when they've been on Medicaid and Medicaid has been covering most or all of their expenses with little out of pocket. And the answer to that is no. You, in order to be eligible for Medicaid, you are required to apply for any programs that you may be eligible for, including Medicare. However, once you're on Medicare, there are other government programs that will help with some of the costs, such as extra help with prescription drugs, Medicare savings programs, and medically needy or share of costs. So when you're making this transition or approaching it, you may want to call a SHINE counselor and speak with us about the transition. So we'd be glad to help you with that.
That's excellent. And also, how can someone find out if Medicare covers transportation?
Medicare doesn't cover non-emergency medical transport. Some Advantage plans do provide benefits for non-emergency medical transport. So if that's an issue for you, you should call us at SHINE and we can show you the Medicare Advantage plans that would be available in your county and the transportation benefits that they provide, and make sure that those Advantage plans would work for you in other ways, such as your drug expense and your doctors and so on. But give us a call at SHINE and we can see what we can do with transportation expense.
That's great. So there are options there.
Yes, there are.
So another question that we get, what is AACA, AACA?
There are two state agencies that are involved in the administration of the Medicaid program in Florida. The first is ACCESS, or the Department of Children and Families. They are the agency which determines eligibility, and you apply through ACCESS. The second agency that's involved in Medicaid is the Agency for Healthcare Administration, or AACA. They are responsible for other administrative duties connected with Medicaid, including certifying and approving the providers, the Medicaid providers. If you want more information about either of these agencies, you can go on their websites. The website for ACCESS is myflorida.com/AccessFlorida, without a space in between Access and Florida. The website for AACA is ahca.myflorida.com.
Thank you. And lastly, what people wonder, sometimes they ask, like, why are their out-of-pocket costs, they're so high?
Medicare was never intended to cover all out-of-pocket costs associated with healthcare. When Medicare went into effect back in the 1960s, healthcare costs were a lot lower. Since that time, though, for a variety of reasons, healthcare costs have increased much more rapidly than the general cost of living. Another factor is that back in the 1960s, many employers offered supplemental benefits to their retirees. This is becoming increasingly less common. So as a result of both of these factors, people often struggle to afford the out-of-pocket costs that they have with their Medicare. However, there are a number of programs that can help with these costs, both government programs and non-governmental programs. Government programs such as extra help with prescription drugs, Medicare savings programs, and medically needy or share of cost, and other programs such as patient assistance programs that help with prescription drug costs. So if you're struggling to afford your Medicare costs, I would urge you to contact us at SHINE and let us help you see if there are solutions to your cost issues.
Thank you, Jim. Well, I hope that, everybody have all their questions answered. I'm sure there are more, of course. So if you have any questions related to your own, Medicare, no matter what they are, please give us a call at 1-800-963-5337, and we can connect you with one of our SHINE volunteers. Thank you, Jim.
Thank you.